How are you doing, everybody? My name is Jatorius Trammell, and today I'll be talking about psychological evaluations and ethical concerns, navigating challenges in group settings. First, we're talking about confidentiality and privacy. Okay, thank you. The importance of confidentiality in group settings. In any group setting, confidentiality is the cornerstone of trust. It's the foundation that allows participants to share openly and honestly, knowing their words will remain protected. When confidentiality is respected, people feel safe to express themselves, which leads to a more authentic and meaningful conversation. But it's not just about keeping secrets, it's about creating a space where individuals can feel heard, valued, and understood. Confidentiality also empowers facilitators to assess the group's progress accurately without fear of judgment or misrepresentation. However, it is essential to understand the limits of confidentiality. In some cases, there may be legal or ethical obligations to disclose information, especially if someone's safety is at risk. Setting clear boundaries around confidentiality from the start helps everyone navigate these situations with trust and clarity. Ultimately, confidentiality isn't just a rule, it's a vital part of fostering a secure environment where personal stories can be shared, and growth can happen, and the group can thrive together. Risk of information disclosure. In group settings, the exchange of personal information is an important part of connection and growth. But there is a risk. That information can unintentionally be shared outside the group. While most participants have the best interest, sometimes details may slip or boundaries may be misunderstood. That's why it's crucial for therapists and facilitators to educate group members about the potential risk of information disclosure. When participants are aware of the consequences, whether it's damaging trust or affecting someone's privacy, they can make more informed choices about what they share. Maintaining confidentiality isn't just about rules; it's about protecting each person's personal space and dignity. By setting clear expectations and fostering an environment of mutual respect, therapists help safeguard the privacy of every individual during evaluation and discussions. At the heart of it all is trust. By understanding the risk and respecting confidentialities, group can stay safe, secure, and supportive, ensuring everyone feels respected and heard. Protect privacy, build trust, keep confidentiality at the forefront. Facilitating respect for confidentiality. In group settings, therapists play a critical role in fostering respect for confidentiality. It's not just about setting rules, it's about creating a safe space where every individual feels secure in sharing their personal experiences. To do this, therapists must clearly explain the limits to confidentiality at the start. Participants need to understand what information is protected and what situations may require disclosure, especially when safety is at risk. Equally important is prompting group norms that reinforce respect for each other's privacy. By encouraging open communication, setting clear expectations, and modeling respectful behavior, therapists help ensure that sensitive information shared during evaluation stay protected. When confidentiality is upheld, trust flourishes, and participants can engage more openly and honestly, knowing their personal disclosures are valued and respected. Creating an environment of respect for confidentiality isn't just about following the rules; it's about fostering a culture of care, safety, and mutual respect within the group. Protecting confidentiality is a responsibility we all share because respect begins with trust. Next topic. Informed consent, specifically starting off with necessity of informed consent. In any group evaluation, informed consent is not just a formality, it's a fundamental right that protects each participant's autonomy. Before participating, every individual must fully understand what the evaluation involves, from its goals to specific expectations placed on them. Informed consent means participants know exactly what to expect, including any potential risk or benefits. This transparency allows them to make an educated decision about whether or not they wish to participate, ensuring that their choice is based on clear, accurate information. When participants give informed consent, they do so with confidence, knowing their rights are respected and their privacy is protected and their well being is a priority. It also promotes a sense of trust and accountability between participants and facilitators, creating a foundation of positive and ethical group experiences. Um, Ultimately, informed consent is about honing each person's right to make decisions that are their best interests. that are in their best interest, empowering them to participate in a safe, supportive environment. Informed consent is a cornerstone of trust, autonomy, and respect in group evaluations. Transparency about evaluation process. In any group setting, transparency is a key to building trust, ensuring that participants feel safe and valued. When it comes to evaluations, it's essential that everyone understands the process from start to finish. From the moment participants enter the room, they should be informed about what to expect. This includes a clear explanation of how data will be collected, what kind of information will be gathered, and why it's important. Whether it's through surveys, interviews, or group discussions, participants should always know how their input will contribute to the overall evaluation. But transparency goes beyond just explaining what. Participants also need to understand how their information will be used and most importantly how it will be protected. They must feel confident that their personal data is secure and will be handled with the utmost care and confidentiality. This clarity not only reassures participants, but it also empowers them to make informed decisions about their involvement. When they understand the evaluation process, including any potential risks or benefits, they can engage more freely and honestly, knowing their privacy is safeguarded. Transparency is not just about following ethical guidelines, it's about creating an open, collaborative environment where trust thrives. By clearly communicating every aspect of the evaluation process, facilitators build a foundation of respect, security, and mutual understanding. Ultimately, when participants trust the evaluation process, they're more likely to share valuable insights and contribute to a meaningful, productive experience for everyone involved. Transparency, the key to trust, security, and successful group evaluation process. Voluntary participation and withdrawal rights. In group evaluations, voluntary participation is a fundamental right. Every participant should feel free to choose whether or not to take part without pressure or coercion. This respect for autonomy is essential to maintaining ethical standards and creating a safe, supportive environment. Equally important is the right to withdraw at any time. Participants must know that they can leave the evaluation process at any point for any reason without fear of judgment or negative consequences. Their decision to withdraw should be respected fully, and their privacy should still be protected. By ensuring that the participant is entirely voluntary, we honor each individual's autonomy and create an atmosphere of trust. Participants can engage openly, knowing that their involvement is their choice and that they can leave the process whenever they feel it's no longer right for them. Voluntary participation and the right to withdraw uphold both ethical principles and personal dignity, making sure everyone's voice is respected throughout the evaluation process. Your choice, your voice, your rights, always respected. Next topic is ethical responsibilities. In therapeutic settings, one of the most complex challenges therapists face is the potential for dual relationships, situations where the therapist's role overlaps with other roles, such as a friend, family member, or colleague. These blurred boundaries can create conflicts of interest and complicate therapeutic process. When a therapist takes on multiple roles, it becomes hard to maintain objectivity and partiality. This can affect the quality of the therapeutic relationship and lead to ethical dilemmas. For example, personal connections may influence the therapist's judgment, or participants might feel confused about the nature of the relationship. That's why maintaining clarity in professional roles is essential. By setting clear boundaries and discussing these with participants, therapists ensure that both parties understand the limits of their relationship, which help protect the integrity of the process and prevents conflicts of interest. Staying mindful of dual relationship help safeguard the trust that forms the foundation of therapy. It allows therapists to focus on what truly matters, supporting their clients' well-being and growth. Clarity, boundaries, and focus are key to the navigating the complexities of dual relationships. The competencies of an evaluator is essential to the success of any group evaluation. Facilitators must possess the necessary qualifications, knowledge, and skills to conduct assessments effectively and responsibly. Without this experience, the integrity of the evaluation is at risk. A deep understanding of group dynamics is crucial for interpreting behaviors, interactions, and responses accurately. Inadequate knowledge or experience can lead to a flawed assessment or interventions, potentially compromising the welfare of participants. Evaluators must also be able to adapt to the unique needs of each group, create a supportive environment, and respond appropriately to sensitive issues that may arise. This requires both professional training and practical experience. Ultimately, the welfare of participants depends on the evaluation's ability to conduct thorough ethical evaluations by ensuring evaluators are qualified and competent. We protect the accuracy of the process and the well-being of those involved. Competency in evaluation is not just a requirement, it's a responsibility to the clients we serve. Validity and reliability of assessment tools. In any evaluation process, the validity and reliability of an assessment tool are paramount. These tools must accurately measure what they are intended to measure and produce consistent results over time. If assessment tools are flawed, the results that they yield can be misleading, leading to inaccurate conclusions about participant needs or progress. Misleading evaluation not only undermines the integrity of the process, but also can also have harmful consequences. Participants may be unfairly stigmatized or misrepresented, which could affect their self esteem, access to services, or future opportunities. As evaluators, it is our ethical responsibility to ensure that the tools we use are both valid and reliable. This means selecting instruments that have been rigorously tested and shown to produce accurate and trustworthy results. By using valid and reliable assessments, we uphold our duty to protect participants, provide fair evaluations, and ultimately support their well being and growth. Accuracy and trust are built on valid, reliable tools, key to ethical and effective evaluations. Group dynamics and cultural sensitivity. Group dynamics play a powerful role in shaping the outcome of any evaluation. The way participants interact with each other, their relationship roles, and even their perception of authority can significantly influence the process. In a group setting, dominant voices may overshadow quieter participants, leading to skewed perspectives and incomplete assessments. Individuals may feel pressure to conform to the group, or their contributions might be dismissed or overlooked. This can compromise the integrity of the evaluation, making it hard to capture a true, balanced picture of each participant's needs and experiences. As evaluators, it's crucial to be aware of these dynamics. Facilitators must actively create space for all voices to be heard, ensuring that every participant has the opportunity to contribute and that no one is marginalized. By understanding and managing group dynamics, we can preserve the fairness and accuracy of the assessment, allowing each individual's voice to be respected and considered. Group dynamics are powerful, but with awareness and care, we can ensure they enhance, not hinder, the evaluation process. Navigating power imbalances. Power imbalances, whether stemming from status, age, gender, or other factors, can profoundly impact how group members engage during evaluations. These imbalances may cause some voices to dominate while others are silenced or dismissed, leading to unequal participation in the process. For example, individuals with higher status or more authority may unintentionally influence the direction of the conversation, while those with less power may feel hesitant to speak up or share their true feelings. This can distort the evaluation and result in biased or incomplete insights. As facilitators, it is essential to address these power dynamics head on. This means creating a space where everyone, regardless of their position or identity, feels valued and empowered to contribute. Encouraging open dialogue, actively listening, and using strategies to ensure equal participation can help level the playing field. By addressing power imbalances, we can ensure that all voices are heard, fostering a fair, unbiased evaluation process that reflects the experience and perspectives of every participant. Fairness starts with equality. Acknowledging and addressing power imbalances is key to the inclusive evaluation. Cultural competence matters. Cultural differences play a crucial role in how individuals perceive and respond to psychological evaluations. What is considered appropriate or meaningful in one culture may be interpreted very differently in another. Without cultural competence, evaluators risk misinterpreting behaviors, responses, or emotions, leading to bias or inaccurate conclusions. Being culturally competent means understanding and respecting diverse backgrounds and experiences of each participant. It's about recognizing that cultural values, norms, and communication styles can influence how someone engages with the evaluation process, from how they answer questions to how they interpret feedback. Evaluators must be mindful of these differences and adapt their methods to ensure fairness and respect. This may involve adjusting language, using culturally relevant examples, or simply being aware of cultural sensitivities. By embracing cultural competence, Evaluators can create a more inclusive, accurate, and effective evaluation process, one that respects and values the unique perspective of all participants. And finally, we are in the last phase, ensuring valid assessments. Accurate assessments rely on more than just right tools. They require a deep understanding of the cultural context and group dynamics at play. Evaluators must be aware that cultural backgrounds and social dynamics can influence how participants respond, interpret questions, and engage in the evaluation process. To ensure valid assessments, it is essential to use tools that are not only reliable but also culturally appropriate. This means selecting assessment methods that accurately account for cultural differences, communication styles, and values to avoid misinterpretation or harm to participants. Without this cultural awareness, evaluations risk reinforcing stereotypes, overlooking critical factors, or drawing conclusions that don't accurately reflect participants' experiences. By incorporating cultural sensitive tools and approaches, evaluators can create assessments that are fair, accurate, and respectful, ensuring that every participant's voice is heard and understood within their unique context. Valid assessments require cultural competence and ensuring that evaluators are both accurate and ethical for all involved. Thank you all for watching, and I hope you learned something from my presentation. My name is Tori Schmel, and I hope that y'all have a blessed day.